Hi everyone, this is Dr. Divya Desa. Welcome to my channel Ace Anatomy. I'm here to make anatomy super easy, fun and unforgettable. Today in Decode Anatomy series, I'll be discussing about the axillary nerve. So hit the subscribe, ring the bell and join me. Axillary nerve is the branch of the posterior cord of the brachial plexus which is formed by the posterior divisions of upper, middle and the lower trunks. Once it is formed, it runs backwards on the subscapularis muscle to pass through the quadrangular space along with the posterior circumflex humeral artery. Here it is intimately related to the medial aspect of the surgical neck of the humerus, just inferior to the capsule of the shoulder joint. And here the nerve will give a branch to the shoulder joint and then it will pass laterally, deep to the deltoid where it divides into an anterior and posterior divisions. Now let me break down the formation, the cause and the distribution of the axillary nerve step by step for you. So let's see the formation of the axillary nerve. So we have the ventral rami of C5 and C6 nerves which form the upper trunk, and this divides into an anterior division. This dotted line is the anterior division and this is the posterior division. We have the ventral rami of C7 forming the middle trunk which again divides into the posterior division and an anterior division. And then we have the ventral rami of C8 and T1 joining to form the middle trunk and which also gives the anterior and posterior divisions. Now the posterior divisions from all the three trunks, upper, middle and the lower trunk, they join to form the posterior cord. And this posterior cord, it gives these branches, that is upper subscapular, lower subscapular, nerve to latissimus dorsi, the axillary nerve and the radial nerve. Now though the posterior cord is contributed by all the roots, that is the C5, C6, C7, C8 and T1, the root value of axillary nerve, we say it as C5 and C6. And why do we say so? Let us look at this segmental innervation. So in the region supplied by the axillary nerve, the segmental innervation is mainly by the C5 and C6 spinal segments. So the axillary nerve carries these fibers, that is C5 and C6. So hence we say the root value of axillary nerve as C5 and C6. Now let's look at the branches of the axillary nerve. So the axillary nerve with the root value of C5 and C6 arises from the posterior cord of the brachial plexus at the lower border of subscapularis, and it passes through the quadrangular space along with the posterior circumflex humeral artery. So there it will be intimately related to the surgical neck of the humerus. Then it passes laterally and deep to the deltoid muscle. It divides into an anterior and a posterior branch. Now let's look at the branches. So near the surgical neck, it gives a branch to the shoulder joint. And the anterior and the posterior branch, they supply the deltoid muscle. The posterior branch also gives a branch to the teres minor muscle, and this posterior branch you need to know that it ends up in a pseudoganglion. And the cutaneous branches are also given by both the anterior and posterior divisions. The anterior division supplies the skin over the lower half of the deltoid, and the posterior division, it supplies the upper lateral part of the arm by giving the upper lateral cutaneous nerve of arm. So thus the axillary nerve gives articular branches to the shoulder joint, muscular branches to the deltoid muscle and teres minor, and cutaneous branch over the upper lateral part of the arm. So to summarize the axillary nerve, first the root value. So the root value is C5, C6. and the origin is from the posterior cord of the brachial plexus. Termination is deep to the deltoid muscle, where it divides into anterior branch and a posterior branch. Coming to the course, so it, after being given by the posterior cord of the brachial plexus, it passes backwards on the subscapularis, passes through the quadrangular space, and where it lies intimately to the surgical neck of the humerus here. Okay, and then it runs laterally and divides into its terminal branches, that is anterior and posterior branches, deep to the deltoid. So coming to the branches, articular branch to the shoulder joint, muscular branch to the deltoid and teres minor, and cutaneous branch as the upper cutaneous nerve of arm, as well as the skin over the lower half of the deltoid region. And that's a wrap for today's episode of Decode Anatomy. The clinical aspects of axillary nerve will be dealt in my next video of Anatomy in Practice. If you want any video on a particular topic, you can leave it in the chat box. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends, and hit the subscribe. Ring the bell so that you're the first one to know when I decode another fascinating topic. So keep learning, stay curious, and never stop exploring the wonders of anatomy. Until then, next time.